Okay, listen to this title. Just listen to this title, then ask yourself whether or not she knows a little bit more than you do about vaccinations and statistics when it comes to it. Now, she's not going to like me saying that because she's not that type of person, but I'm going to, and I don't care. Kylie Hall is Operations Director with NDSU's Department of Public Health, the Center for Immunization Research and Education. That's her profession. That's what she does. And so what we're about to talk about, I hope people take a step back, and as locked in as what some of you are when it comes to vaccinations, I hope you take a step back and just listen to what she's got to say. Kylie, good to have you back as we head on down the road.
Thanks for that nice introduction, Joel.
I want to talk about updates. I want to find out how North Dakota is doing. What's our numbers?
Yeah, so we have vaccinated almost 70% of our adult population, 18 and older. Certainly, we wish it was a little bit higher, but we're approaching that 70% mark. I think the number that we're watching really closely is that 5 to 11-year-old population. That is the group that was recently approved to start getting their COVID-19 vaccines. And with that rollout has been happening for about 2 weeks, and we have about 5% of our kiddos who have chosen to get vaccinated and who are excited to be vaccinated, and more vaccines are going out the door every day. So that's where we're at. We've got a lot of vaccines going out the door, whether it's kids, whether it's adolescents, whether it's booster doses, a lot of vaccines going into people's arms and keeping them healthy.
Well, ask yourself this. There's very few people. It was my job to raise 2 girls, and it wasn't my job to be their best friend, right? So at times they were wondering whether or not I was a complete pain, and there was other times they didn't even have to ask. They knew. But I've got 6 grandkids from them, 6 that I love dearly, and I can spoil. I can be that guy. Those 6 grandkids have been vaccinated, and it wasn't just because Grandpa offered them ice cream or their parents did. Those 6 kids, their parents looked at and said, you know, with the variants that come, I want my kids protected as much as what I can. And so are those the normal stories? Are they getting it when it comes to kids? I know you showed percentages, but are we at the beginning of that timeline where it can do nothing but get better?
Yeah, I think so. I think we're only going to go up from here. Certainly, we're hearing from a lot of parents and anecdotal stories from friends and family members. They've chosen to get their kids vaccinated, not only because they don't want them to get sick, but because of the disruptions that COVID has caused in schools. They want their kids to be able to play sports. They want them to be in the drama production or whatever it might be. They want their kids to go to school and just, you know, not have to stay home with them if they're quarantined or if they're sick. And so many parents have, you know, different reasons for vaccination, but ultimately we want our kids to be healthy. We want them to be in school. School is the place where they're learning, they're getting the services they need. And this is one of the ways that we get there.
So where are we at with boosters? I've had my booster. You've had your booster. We talked a little bit before we went on air. You're a young woman. I'm not a young man, but so it shouldn't surprise anyone that I was eligible maybe at a quicker time than what some were. But where are we at overall when it comes to boosters?
Yeah, so when you look at the United States population across the board that's eligible for a booster, I think we're somewhere around 13% have sought out that booster. So we've got a ways to go in terms of getting people that extra protection that they need. Here in North Dakota, we've had an excellent rollout of our booster doses, which we also saw a really great rollout, if you remember, back in January of getting the doses out that were coming in. We led the way there. And I think one of the reasons that we've done that is we've been able to place vaccine in every corner of the state. And the health department has sent out letters, for example, to people who are due for their booster saying, hey, go get your booster, and they'll even help you schedule them if you don't know how to get that scheduled. In terms of who's eligible, so we're still sticking with the recommendations from a few weeks ago that high-risk populations are eligible, those 65 plus, those who have underlying medical conditions, and then those who work in high-risk exposure jobs or in healthcare. But we're seeing a little bit of a shift in the conversation to some states just saying outright, go get your booster. One of the qualifications right now for booster doses is if you live in an area of high transmission, which is a test positivity rate above 5%, which all of North Dakota is considered high transmission. So if you're eligible for that booster, I would say, you know what, think about going to get it. You know, Thanksgiving is only 10 days away now. Get a little bit of extra protection by then, and for sure have it by Christmas, especially if you're going to go see grandma, especially if you're going to go see that aunt who has cancer, or if there's people that you're going to be around who can't get their booster yet, like young children. Consider going to get that extra protection before the holidays.
I want to talk a little bit about just the sheer numbers, as we did earlier, about people vaccinated, but I want to add in those people that are unvaccinated that have had COVID. Mm-hmm. So, we always say that North Dakota is such a low vaccine state. I get it. I understand it. That's pretty easy to track. But is there a way to track those individuals that said no? And Kylie, the reason I'm asking this is I've got a friend, and that friend is an anti-vaxxer, and his son is an anti-vaxxer. And the son isn't, people are going to say, well, is he diabetic? Is he heavy? Is he all? None of the above. Healthy as a horse, very active. He contracts COVID, the Delta variant, finds himself fighting for his life at what I call Mericare at Sanford here in Fargo. The North Campus. So, those are out there. And I asked the family, I said, does this change your mind when it comes to the vaccine? Knowing that you can still get COVID, but it's far less likely to kill you, because they're sitting there praying and doing everything they can on behalf of their son and husband. So do you think that'll change things? Do you think that people that have COVID, as bad as what he did, maybe have an immunity? Do you think any of that will change anything, Kylie?
Sometimes it does, and sometimes it doesn't. We hear stories about individuals who didn't take the vaccine seriously, end up with really serious COVID, and either in their final days or, once they recover, they're saying, man, I wish I would have got that vaccine. And now they're encouraging all of their family and friends to go and get it. Similarly, sometimes we see people who get a really serious case of COVID, they get out of the hospital and they say, I wouldn't have changed anything. I wouldn't have received that vaccine. There's nothing you can do that would make me get that vaccine. It's still too new, or what have you. And now they think they have natural immunity. And certainly there is a piece to natural immunity, but it's unpredictable and we don't know how long it lasts. And that's why we encourage everybody to go get vaccinated. Now, we have to have those hard conversations, and we have to build that trusting relationship with those people. It's hard. I think we all know someone who's been in that boat, and we're gonna continue dealing with this pandemic until we can get enough people vaccinated or who have immunity at the same time, and we're proving that that's harder to come by than we thought. We're almost 2 years into this pandemic, and we're still dealing with spikes. We're still dealing with a lot of the economic impacts. This isn't going away anytime soon.
Kylie, at some point, you look out for everyone. I get it. At some point, people like me aren't going to care whether or not they got themselves vaccinated or not, other than the fact that you can get a new variant because of them. But I appreciate it. Thanks for coming on.